My name is Leslie Cornwell. I am the midwife director of Midwifery Business Consultation. Today I want to talk to you about the myths with midwives. There are so many things out there. Just people don't understand what a midwife is, what the education is like. Will my insurance cover them? They only deliver in the home setting. I want an epidural. The list goes on and on. I want to set the record straight of what midwives can do in the United States and what the services look like. So I'm going to speak for a certified nurse midwife right now just because that's my background expertise. A certified nurse midwife can practice in the home setting, a birth center, or the hospital. She can work, and I've met a few nurse midwife male counterparts, can practice independently or can work for a physician. A lot of it, even though we have a national certification and a master's in nursing, each state sometimes has rules of what a nurse midwife can do. So sometimes there is a supervisory relationship in place, not because of education, but maybe the state regulations. Prescription privileges are mostly independent for most states, getting more and more as time goes on to the independence of what a nurse midwife can do. For insurance reimbursement, I could easily get reimbursed for a home birth, birth center, hospital delivery under my own NPI and my own name. Sometimes if you work for a hospital system in their bylaws and their contract they have with the insurance company in the backdrop, nurse midwives have to bill under their collaborating supervising physician, just depending on the verbiage of the contract they have arranged. But yeah, so I had a lot of people are like, oh, I can't afford a home birth. I'd have to do it with cash. And there's just a lot of misunderstandings that if your insurance plan has coverage for out-of-hospital births and a nurse midwife, we can definitely talk and get that taken care of. So there's a lot of misunderstandings with that. A lot of people will discuss, well, I'm not that natural. I mean, midwives are awesome and everything, but I want an epidural. I want the hospital. I want pain medicine. And midwives are there to support women. Our thing is with women. I'm like, I don't care if you got an epidural. I don't care if you wanted the most traditional medical birth. You wanted a C-section and wanted a midwife with you. Our goal is to support you in any way we can. And that may be she may be more high risk. Maybe she didn't intend to have a breech presentation and it's her first baby and the decision was made to do a C-section. Having that aspect of first assist and being able to stay with the woman from beginning to the end is so invaluable. So don't ever think, well, I don't want a water birth, I don't want a home birth, I want my epidural and I want to have all I want a medical birth plan. I'd be like, okay, let's talk about it. But a midwife supports women. So that's the big thing I want to stress. Other myths that I've heard are, oh, I'm too high risk, I can't have a midwife. There's this myth of you have to be super healthy, athletic, granola, crunchy, super natural to see a midwife. We co-manage all the time with physicians for things that are a little more out of our scope: gestational diabetes, hypertension, twins, breech. There's so many things. The baby's big, the baby's small. The ultrasound showed something a little off. We work closely with physicians and the medical team to make sure that we're giving safe care to our families. So just because you're high risk, we may not be able to do an out-of-hospital birth. We may not be able to independently care for you, but we can be your main point person to be your service care provider, and that's really important. The one I always laughed about when I went to expos, I'd go to women's health expos and the cross would come up. They'd be like, stay away from me. I'm done having babies. I don't need a midwife. I'm not getting pregnant. I'm not going to talk to you because you'll make me pregnant. And there's just so many myths that midwifery care is not just pregnancy and birth. Well, woman care. Look at us similar to a nurse practitioner, women's health care provider. We do well woman care. We do GYN services, birth control. I love taking care of 16 to 19-year-old women that have never seen a healthcare provider before and are having their first annual exam. Those women are they're just innocent blank slates that haven't been exposed to this traditional healthcare system. I can order labs, ultrasounds, testing, screenings, you name it. And then I stress it's kind of like a family practice physician. If you need a specialist, you have a mole on your back, we remove it and biopsy it, I can send you to a dermatologist just like a physician can do. So I think it's getting past this myth and understanding that midwives just do pregnancy, birth, and that's it. And after you're done having your baby, you move on to somebody else. I have a lot of women I've taken care of for years and years. For well women, they're done having babies. And I'd love to see more women choosing midwives from the get-go versus after they have their babies. It's not your most common thought process when you're 18 and looking for birth control. I'm going to look for a midwife. You look for an OB. So a lot of the misunderstandings, like a certified nurse midwife compared to a certified professional midwife, a nurse midwife can order ultrasounds, labs, and testing. Most certified professional midwives have to have some arrangement with a physician to be able to get routine prenatal testing, like your 20-week anatomy, ultrasound, your initial prenatal labs. You want a prenatal vitamin that's free at the local pharmacy, that simple prescription. Most of the time you'd have to be seeing a certified nurse midwife to make that happen, or she has an arrangement with a physician ahead of time, which is awesome and great. But just I had so many women are like, well, I'll co-manage with my doctor, because they just don't understand the difference of what a nurse midwife or the different kinds of midwifery services available. So yeah, so nurse midwives can independently order labs, ultrasounds, testing at any facility that you're interested in using. So don't have that be a barrier to, well, I can't get my testing if I choose a home birth. That's not the case. And then I guess the biggest is just a lot of people think, oh, a nurse midwife only delivers in the hospital. Most nurse midwives do choose to deliver in the hospital because that's more of the standard of care. Certified professional midwives tend to be more out of hospital birth, but there's nurse midwives that do out of hospital births all the time. And so just ask the training, ask the skill set of the midwife you're interviewing, the midwife you're looking to be with, and what services and skills they have. It's more individualized than just a blanket slate that midwives deliver only in the home. That's not always the case. So yeah, let me know if you have any other questions. I love feedback and suggestions for future videos. Please subscribe to our channel and like us on Facebook. My name's Leslie Cornwell, certified nurse midwife with Midwifery Business Consultation. Thank you.